Welcome to our fun little study group for PP 5340 Introduction to Public Policy and Management.
Yeah, good to be diving in.
These are the readings from Section 12, Performance Measurement and Management. And today we're taking a deep dive into, well, the fascinating and, let's be honest, often tricky world of how governments and public agencies try to measure what they do. We'll explore what happens when those efforts, lead to genuine improvements, and just as frequently, when they go spectacularly, maybe even paradoxically, wrong.
That's right. And this area is absolutely critical, I think, for anyone interested in understanding how public services get evaluated, funded, and ultimately improved.
Or sometimes not improved.
Or, as we'll definitely see, sometimes inadvertently hindered. Our mission today isn't just to summarize, really. It's more about exposing the core tensions and maybe some surprising truths about government performance.
Okay.
Giving you, the listener, a shortcut to truly understanding why measuring public services is often, a double-edged sword, and crucially, how maybe you can wield it effectively.
And we have quite a stack of sources to help us do that. A really rich collection, actually, that lays the groundwork.
We do.
We'll be drawing insights from The Performance Paradox in the Public Sector by Sandra Van Thiel and Franz L. Leeuw. That one really sets the stage for understanding the challenges, I think.
Definitely. It's foundational.
Then we'll look at two pieces focused specifically on the public transit industry. First, Comparative Performance in Urban Bus Transit, Assessing Privatization Strategies by James L. Perry and Timlin T. Babitsky. And second, Does Performance Management Lead to Better Outcomes? Evidence from the U.S. Public Transit Industry by Theodore H. Poister, Obed Q. Pasha, and Lauren Hamilton Edwards.
Right, contrasting perspectives there.
Exactly. Then we'll pivot a bit to practical tools with Improving Service Delivery in Government with Lean Six Sigma by John Maleyeff.
Yeah, getting into the how.
And finally, we'll examine Outcomes-Based Performance Management in the Public Sector by Burt Barnow and Jeffrey Smith, alongside a really specific case study. Performance Contracting for Substance Abuse Treatment by Margaret Commons, Thomas G. McGuire, and Michael H. Riordan.
Phew. It's a lot to cover, yeah, but the connections between these pretty diverse pieces are truly illuminating. By looking at both the theory, the critiques, and the practical case studies, you should walk away with some pretty profound aha moments about just how complex performance is in the public sector.
Absolutely. So let's begin our exploration. Let's take a closer look at performance measurement and management. Okay, so to really understand the landscape, let's set the stage with that first source we mentioned, The Performance Paradox in the Public Sector by Van Thiel and Leeuw.
Right.
They kick things off by observing something that feels, well, almost obvious now, but maybe wasn't always. SATEs, at every single level, local, regional, national, even supranational, are dedicating just unprecedented levels of attention, time, and importantly, money to performance measurement and evaluation.
It's everywhere.
Everywhere. Schools, universities, local governments, aid organizations, even the World Bank.
Yeah.
It really is this global thing that seems to have fundamentally reshaped public administration.
It's definitely more than just a trend, you're right. It feels like a profound cultural shift. Michael Power, who's a prominent scholar in this field, he even calls it the audit explosion or the audit society. And that's not just about doing more audits, right? It suggests this fundamental pervasive transformation where the very act of auditing, of scrutinizing and measuring, it's become a defining characteristic of how public organizations operate.
Okay.
It's a really deep-seated change, moving, from a system that was maybe based largely on trust and process to one that's much more driven by verifiable metrics, numbers.
Audit society. It's a strong phrase.
Yeah.
It really conjures this image of constant oversight where everything is potentially quantifiable. And Van Thiel and Leeuw, they note that this surge, this explosion of interest, it largely lines up with a really significant wave of administrative reform back in the 1980s.
Yeah.
What exactly triggered that pivotal shift? What was going on then?
Well, the 1980s, you have to remember, were a period of pretty intense economic restructuring, lots of increased international competition across most Western states.
Right.
So facing these fiscal pressures and a growing perception, fair or not, of government inefficiency, there was this widespread movement to reform public administration, and this became known as New Public Management, or NPM.
NPM. Heard that term a lot.
Yeah. And it wasn't just about cutting costs, though that was a big part of it. It was really a paradigm shift. It challenged the whole notion of traditional bureaucratic governance, which was often seen as, rigid, slow, process-driven, unresponsive.
Okay.
So the objectives of NPM were pretty ambitious. First, yeah, drastically cut government budgets. Fiscal strain, slow growth demanded it. Second, and just as important, was to significantly improve the efficiency and effectiveness of the bureaucracy itself.
Make it work better.
Right. And to do that, government started introducing these market-type mechanisms directly into the public sector, borrowing heavily from private sector practices.
Like what?
Well, things like privatization of state-owned companies, competitive tendering for public services where private firms could bid against public providers, even things like vouchers for public services trying to give citizens more choice. And they also started hiving off departmental units into these quasi-autonomous non-governmental organizations, or quangos. The hope was to make them more flexible, more entrepreneurial, more business-like, basically free from the perceived constraints of traditional bureaucracy.
So essentially, the core idea was injecting market discipline, private sector thinking into how government works.
Exactly.
Our second source, that Perry and Babitsky piece on urban bus transit, it touches on this exact philosophy, right? Highlighting how the search for better public services consistently involved finding appropriate structures, often leading to privatization or private involvement for efficiency gains.
That's right. It was a consistent theme. And the core belief underpinning all these reforms and that whole audit explosion was pretty straightforward, really. If you could accurately measure performance,
Then you could manage it better.
then you could manage it better, which would inevitably lead to more efficient, more effective policy implementation. Simple, right?
Seems logical.
So this included using new tools like performance indicators, not just to look back and evaluate, but also to proactively increase accountability, another key goal, making government more transparent, more answerable. The whole movement was built on this very strong, maybe even, unwavering belief in the inherent measurability of public sector performance.
Assuming you could measure it like a factory output.
Pretty much. Assuming public services could be quantified and assessed like private sector outputs, clear inputs, outputs, outcomes.
But, and here's the kicker, Van Thiel and Leeuw warn us that this belief might have been, well, their words, somewhat simplistic.
Yeah, that's putting it mildly, perhaps.
So this sounds critical. What happened when this seemingly good, logical idea of measuring everything, of quantifying complex public services, met the often messy, multifaceted reality of the public sector? Was there a collision?
Yeah, this is where the story takes a really intriguing, maybe slightly depressing turn. Because despite all that attention, all that time, all that money poured into performance measurement, Van Thiel and Leeuw tell us many attempts to introduce results-based management are still, well, unsuccessful.
Right. They're just not delivering the expected gains. Or worse, sometimes they're creating whole new problems.
Which brings us right to what they call the performance paradox.
Exactly. And this performance paradox, it's a critical insight. It refers to this weak correlation, or sometimes even a direct disconnect, between the performance indicators, the numbers, and actual performance itself.
So the numbers lie, or don't tell the whole story. Essentially, yeah. The numbers that get meticulously collected and reported don't always accurately reflect what's truly happening on the ground. And even more troubling, these indicators can actively distort the real picture, leading to decisions that are actually counterproductive. It's a fundamental challenge that questions the very foundation of all those measurement efforts we just talked about.
Okay, so what causes this paradox? Why do the indicators fail us? Van Thiel and Leeuw list several reasons. One is that indicators can simply run down over time.
Yeah, they lose their value.
They get stale.
Yeah.
They stop being able to tell the difference between good and bad performance.
Exactly. They lose their initial diagnostic power. We also see auditors, in practice, often focusing on procedures and compliance rather than really digging into the actual performance outcomes.
Box sticking.
Pretty much. Or they focus on the mere presence of indicators. Do you have indicators? Check. Rather than their quality, their relevance, their actual content, the emphasis shifts from genuine improvement to just this bureaucratic checkbox exercise. And the goal becomes simply having the system, reporting the numbers, losing sight of the real objective, measuring to get better outcomes. That procedural focus, while it ensures process accountability, can tragically mask real issues and let poor performance just keep going.
That's a crucial distinction. Okay, let's unpack this a bit more. Van Thiel and Leeuw point to these unintended consequences, negative side effects that nobody planned for.
Right.
Bacart and Balk apparently identified 13 diseases of public productivity measurement way back in 1991.
Yeah.
That sounds ominous. What were some of those? What do they tell us about the early warnings?
Yeah, these diseases are quite vivid, actually. They were designed to highlight the sometimes absurd assumptions behind some early measurement efforts. One is the Pangloss disease.
Okay.
It's a sarcastic reference to Voltaire's character, basically embodying the idea that government is efficient, because if it is not efficient, why hasn't it already been changed?
Right.
It highlights the sort of inherent, almost institutionalized resistance within public agencies to even acknowledge inefficiency or question the status quo. It's this comforting but ultimately false belief that can just stifle any real drive for improvement.
Okay, what else?
Another good one is the Mandelbrot disease. This suggests that apparent problems can sometimes just be a result of better, more detailed measurement techniques.
How so?
Well, the example given is something like Northern Great Britain seems to have more fires than other European countries because it has a better statistical technique for measuring.
Ah, I see. The problem isn't new, we're just better at counting it.
Exactly, which can lead to misinterpretations of trends. These early observations highlight a fundamental human thing. When you introduce a new measurement system, people will, consciously or not, adapt their behavior to optimize for that measurement. Sometimes,
The detriment of the original goal.
precisely. So Bucher and Balg argued for this crucial management of the meaning of measurement, emphasizing careful interpretation, understanding context over just raw, uncontextualized data.
That's incredibly insightful. Sometimes the problem isn't new, just our ability to see it more clearly. Or the tool itself creates the appearance of a problem. Now, building on this, Smith in 1995 wrote about 8 unintended consequences, providing a more detailed breakdown. What were some of those, and did they actually happen? Were these real-world problems?
Oh, absolutely they happened. Fitzgibbon's 1997 survey of over 100 UK primary school head teachers confirmed them not as abstract worries, but as actual, already perceived problems that were actively disrupting the education system.
Okay, like what?
Several really detrimental effects on how organizations behaved. One was ossification.
Ossification, like balloons.
Sort of, yeah. Organizational paralysis. Inhibition of innovation. When the focus becomes solely on hitting specific indicators, organizations get rigid. They become unwilling to take risks or try new things that might actually improve service in the long run but could temporarily mess up their numbers. It stifles creativity.
Okay, makes sense.
Then there's tunnel vision, an overemphasis on the easily quantified stuff.
Inevitably leading to neglect of the unquantified but maybe more important stuff.
Exactly. If it isn't measured, it doesn't get managed, right? So crucial qualitative aspects of service would just fall by the wayside.
What else?
Suboptimization. This happens when managers intensely focus on their own narrow, local objectives or departmental targets, often at the expense of the organization's overall strategic goals. Individual units might look fantastic on paper.
But the whole system suffers because no one's looking at the big picture.
Precisely. And finally, measure fixation. An excessive, almost obsessive emphasis on a single measure of success rather than the underlying objective that measure was supposed to represent.
The indicator becomes the goal itself.
Exactly, not a proxy for the goal, which leads to all sorts of perverse incentives.
So, counterintuitively, focusing too much on the numbers can actually make organizations worse, less innovative. Do we have concrete examples of this ossification or tunnel vision actually playing out?
Many. In education, RAND researchers found in the U.S. too much focus on criteria and benchmarks led mediocre institutions to just mimic the outward appearance of prestigious universities, their buildings, their admin structures, instead of truly improving teaching or learning outcomes.
Wow. Optimizing for appearance, not substance.
Exactly. Similarly, the British Quality Assurance Agency for Higher Ed faced huge criticism for inflexible criteria, focusing too much on administrative compliance rather than the genuine quality of education. And maybe even more starkly, that study on U.S. Federal Inspectors General by Light back in '93 found this startling correlation. As the IG numbers go up, effectiveness may go down.
Whoa. More oversight, less effectiveness.
It's a clear, stark illustration of the performance paradox. The very act of increasing oversight designed to boost accountability can ironically lead to a decline in actual effectiveness, maybe by diverting resources to reporting, or maybe by fostering a culture of risk aversion.
That's truly fascinating. It sounds like the system can be gamed, distorted, and sometimes the measurement itself is just counterproductive, a burden. What about performance budgeting? Did that fare any better? That was supposed to link funding to results, right?
Well, Schmidlin in '99 noted something quite telling. Very few rigorous studies had even been done on its effectiveness, despite 37 U.S. states using it by then.
That's a red flag itself. Lack of evaluation.
Definitely. And he describes what he calls a black market situation. Government officials publicly claim they're managing schools based on output metrics. But behind closed doors, school boards admit they're just continuing as before, often ignoring or working around the formal requirements.
Yeah.
He concludes, pretty bluntly, that any system employing financial incentives that are expected to achieve selective outcomes is highly experimental and will almost certainly create unintended consequences, some of them negative. The lack of evaluation, the observed gaming, it suggests it largely failed to deliver on its promises, highlighting how hard it is to just paste private sector tools onto public sector realities.
So it's not just about unintended consequences, good intentions going wrong, but sometimes a deliberate effort to game the system, to make the numbers look good without actually improving.
Exactly. Which takes us from accidental paradox to intentional distortion.
Okay, so we've talked about how good intentions can backfire, unintended consequences. But Van Thiel and Leeuw take this a big step further. They actually assert that public sector organizations might decide to evoke a performance paradox on purpose.
Yeah, that's a strong claim.
It is. It suggests conscious manipulation. What does that look like in practice? How do organizations intentionally game the system to appear successful even when they're not?
It's a serious and frankly troubling concern when organizations consciously decide to manipulate the system. They give several examples of this kind of deliberate behavior. One is simply sabotaging an audit.
Sabotaging? How?
Well, if an organization perceives an audit as, say, an act of distrust or just an undue burden, or maybe they fear negative findings, they might intentionally engage in strategic delays, dragging their feet, providing information, or exhibiting non-cooperative behavior, providing incomplete, misleading, or just really difficult to interpret data. All these actions deliberately contaminate the relationship between what's reported as performance and what's actually happening.
So the goal isn't improvement, it's frustration or obfuscation.
Exactly. It's not about getting better. It's about frustrating the measurement process itself or just hiding the true performance picture.
So instead of improving services, they just make the numbers look better or make it impossible to really assess the numbers. It's a defensive strategy.
Precisely. This is often called perverse learning or actively hiding ill performance by misrepresenting or misinterpreting the indicators. And many of Smith's unintended consequences we just discussed, they fit perfectly here when used with deliberate intent.
Like which ones?
Well, tunnel vision, deliberate. Instead of unintentionally neglecting unmeasured areas, organizations intentionally emphasize the stuff that's easily quantifiable and looks good, while deliberately omitting reports or downplaying areas that are hard to measure or where performance is weak.
Highlighting the shiny parts, hiding the rust.
You got it. Or sub-optimization, deliberate. Managers might confine their reporting only to the most efficient parts of the organization, creating a misleading picture of overall success, while less efficient bits remain hidden, neglected, or just not subjected to the same scrutiny.
Okay.
And myopia, a deliberate focus only on short-term objectives that can be easily met and quickly reported, even if hitting those short-term wins comes at the expense of crucial but harder to measure long-term goals or strategic outcomes.
Look good now, worry about later.
Exactly. Look good in the next quarterly report, never mind sustainable change.
And there's that specific term for only serving the easy cases, right? Making the organization look more effective by cherry-picking clients.
Yes. Legrand and Bartlett called this cream skimming or cherry-ticking. It's this tendency for service providers, the agents, to discriminate against what they see as inefficient or difficult parts of policies by preferentially providing services only to those clients who are the easiest to serve, the least expensive, or maybe the most likely to show positive outcomes quickly.
Like in healthcare.
Yeah, exactly. It could mean intentionally excluding chronically ill or high-need patients because they consume more resources and might drag down the efficiency or outcome metrics. This practice makes organizations look more successful, more efficient than they really are by artificially inflating their performance figures based on this selection bias.
Right.
The source uses the example of labor exchange agencies, where it might mean focusing on easily employable people rather than those with significant barriers, boosting job placement rates without actually tackling the deeper societal problems.
This reminds me so clearly of that example in the article. The USA Today and American Federation of Teachers survey about education. That one really drove home measure fixation and showed how deeply these incentives can warp behavior, even ethics.
Oh yeah, it's a stark and quite troubling example of both measure fixation and gaming the system. The introduction of standardized tests, high stakes attached to scores. It led to teachers, well, helping their pupils to cheat.
Even if they called it extra help or teaching to the test.
Oh, right. Schools became so obsessed with these tests, these metrics, that curricula narrowed dramatically, focusing mainly on what would be tested, often neglecting broader intellectual development, critical thinking, arts, things that are harder to measure.
Aye.
The why is unfortunately simple. Direct, powerful financial incentives. Student scores directly determine school budgets, teacher salaries, even principals' job security. So while educators might frame it as extra help, it raises serious doubts about whether it genuinely aids intellectual development, the original noble aim.
Yeah.
It's a classic case of gaming the system. Strong emphasis on monitoring efficiency pushes agents to meet demands, even if the policy implementation isn't truly efficient or serving its foundational purpose.
This leads us to a really crucial big picture question. Why is the public sector particularly susceptible to this paradox, both the unintended and deliberate kinds? Maybe more so than a private company facing market pressures. What makes it so vulnerable?
That's a great question. Van Thiel and Leeuw identify several characteristics of the public sector that significantly increase the chance of a performance paradox occurring. It's just a different environment.
Like what?
First, discrepancy in goals. Public policies often have ambiguous, multiple, sometimes even contradictory goals. They're often non-tangible, right? Improve public health. What does that mean in numbers?
Right. Very broad.
So there's often this fundamental gap between those broad policy objectives set by politicians and the more operational, measurable goals of the executive agents implementing them. That ambiguity, which might even be intentional sometimes, complicates creating clear measures and leaves lots of room for deviation.
Okay, what else?
Second, lack of bankruptcy. Unlike private companies, public organizations generally don't face the existential threat of going bankrupt or being completely dismissed in the same way.
Job security.
Basically. This reduced external pressure can, unfortunately, diminish the motivation to genuinely improve beyond what's minimally required. The consequences for underperformance are often less severe, organizationally at least. The entity usually continues to exist.
Makes sense.
Third, cost-revenue disjunction. Many public organizations really struggle to estimate the exact costs of their services. Revenue comes from taxes, mostly, not direct payment.
So it's hard to link performance to the bottom line.
Exactly. Very hard to link performance directly to financial outcomes like a profit-driven company can. This lack of clear cost attribution can also lead to iffy practices like cross-subsidizing, where maybe new commercial activities profit from publicly paid activities, blurring accountability, making true efficiency hard to see.
And finally,
simultaneous production and consumption. Unlike many private goods where you make it, then sell it like a car. Public services are often produced and consumed at the exact same time.
like a teacher teaching a lesson.
Exactly. Or a police officer on patrol, a social worker counseling. The service is delivered as it's being used. And this intrinsic characteristic makes measurement much more complex, isolating clear inputs, outputs, especially long-term outcomes. It's really difficult when the product is intangible, like a service or a behavior change.
So it's this complex web of factors, structural, political, behavioral, that makes performance measurement in government genuinely tricky, really prone to these paradoxes. But it can't all be doom and gloom, right? This isn't insurmountable. There must be ways to make it work, to harness measurement for actual improvement without falling into all these traps.
Absolutely. It's not impossible, just challenging. And that leads us perfectly into looking at some cases where performance management has seemed to yield better outcomes.
Okay, so if the performance paradox is so prevalent, can performance management actually lead to better outcomes in the public sector? Our next two sources offer some, well, hopeful but also sometimes conflicting evidence. Gives us a more nuanced view from the U.S. public transit industry.
Right. Good test case.
Let's start with Perry and Babitsky's Comparative Performance in Urban Bus Transit, Assessing Privatization Strategies. What were they looking at here? What was their core question about public versus private models?
Perry and Babitsky were rigorously examining different organizational forms in urban bus transit, directly tackling that core NPM question. Does private sector involvement, whether through ownership or just management, genuinely lead to better performance.
Okay.
They specifically compared 5 distinct structures: purely privately owned and managed systems, publicly owned systems managed by general government, publicly owned managed by a special authority like a regional transit authority, and then 2 hybrid models: publicly owned general government systems managed by private contractors and publicly owned special authority systems also managed by private contractors.
Like the comparison set.
Yeah. Their aim was to rigorously assess how these 5 structures performed across various indicators: efficiency, like output per dollar; effectiveness, like ridership per vehicle mile; and utilization, basically total ridership. It was a classic empirical test of that NPM hypothesis that private structures are inherently better.
Well, what did they find? Particularly comparing the purely private systems versus the purely public ones. Did the private sector show that clear efficiency edge that proponents argued for?
Well, here's where their findings offer some support for the privatization arguments. They found that the privately owned and managed systems generally produced more output per dollar and generated greater revenues than other types of systems.
Okay, so more efficient.
Yeah, indicating a clear efficiency advantage, delivering more service per dollar, recouping more costs directly. They also use significantly less public assistance, implying more self-sufficiency. And they even achieved better safety records in one of the 2 years they studied, although that indicator was pretty volatile. So yes, there was some tangible evidence of private firms having an efficiency edge.
That seems to bolster the case for private involvement. But what about contract management, where a public agency hires a private firm just to manage the operations, without full privatization of ownership? Was that model also more efficient than purely public management?
This was a really significant finding, actually, because it directly contradicted a key expectation of many privatization strategies. Surprisingly, no.
Really?
Yeah. Perry and Babitsky found no evidence that publicly owned systems managed by contractors performed any more efficiently and effectively than publicly owned, publicly managed systems.
Wow, so just contracting out management didn't automatically lead to better results?
Exactly. That specific mechanism, private management by itself, didn't translate into the anticipated performance improvements in these transit cases.
That is counterintuitive, especially given the NPM push for contracting out. Why do you think those contract-managed systems didn't show the expected gains? What were the barriers there?
They offered a few compelling reasons. One is that the common contracts used in transit, often fixed fee or percentage of revenue, provided few incentives for efficiency and cost cutting.
Ah, the incentives weren't aligned.
Exactly. The contractors didn't take on enough financial risk. Their revenue was largely guaranteed, so there was little direct financial reward for innovating to cut costs or significantly improve service beyond the basic contract terms.
Oh.
There was also often a lack of genuine competition in practice. Once a firm got the contract, inertia often set in. It became hard for the public agency to switch contractors, even if performance wasn't great.
So they became sort of monopolies anyway.
Essentially, yeah. Public monopolies operating under a private facade, unable to capture real competitive pressure. Plus, they noted the professional management team brought in is often a small part of the staff. Most employees still operate under civil service-like incentives, which might not align with aggressive efficiency drives.
This is a powerful insight.
Yeah.
Just changing the structure isn't enough. The real leverage seems to be in designing the incentives within that structure.
Absolutely critical.
So if ownership isn't the main driver, what is? How do we actively manage for better outcomes? This leads us to our next source, which looks at the whole process of performance management. Let's turn to Does Performance Management Lead to Better Outcomes by Poister, Pasha, and Edwards. What was their main question, and how do they tackle this link between management practices and results?
They asked a fundamental question, really challenging that performance paradox idea head on. Do performance management practices, things like strategic planning, setting goals, and performance measurement, monitoring progress, actually contribute to increased effectiveness in public transit? To study it rigorously, they focused on a specific, fairly homogeneous group, small and medium-sized bus systems in urban areas, where these agencies were the sole providers. This controlled for a lot of confounding variables, making their findings more robust.
Smart methodology.
Yeah. And they used original survey data collected directly from transit managers about their specific management practices. Then they combined this with objective outcome data from the Federal Transit Administration's National Transit Database standardized verified performance metrics. This dual data approach was key to linking practices to actual results.
And what were their key findings? Did performance management in this context of focused practices actually work? Did it lead to real improvements?
Yes. They found compelling, empirically supported evidence that more extensive use of performance management practices does in fact contribute to increased effectiveness.
Wow, okay.
It was a strong conclusion. Specifically, both formal strategic planning and robust performance measurement were found to have positive and statistically significant effects on critical outcomes, like passenger trips per capita and passenger trips per vehicle mile operated. Meaning, agencies that actively set long-term goals and then consistently measured their progress actually saw more people riding their buses and were using their services more efficiently. They also found that a blended approach, combining formal strategic planning with a more flexible, adaptive, logical incrementalism was particularly effective, suggesting rigidity isn't always the answer, but a dynamic planning process is key.
That's a strong endorsement for active, deliberate management.
Yeah.
And they even quantified the practical significance, right? Showing these weren't just statistically significant, but meaningful real-world changes.
They absolutely did, and the numbers are quite meaningful. For example, a 1-unit increase in formal strategic planning activity, maybe moving from neutral to agree on a survey item, was estimated to lead to about a 7.4% increase in passenger trips per capita.
That's substantial.
Yeah. And a 7.2% increase in passenger trips per vehicle mile. The effects of performance measurement were even more pronounced. A 1-unit increase there was associated with a 13% increase in passenger trips per capita and a 10% increase in passenger trips per vehicle mile.
Huge numbers in transit terms.
Definitely. They explicitly called these substantial increases and worthy targets for transit agencies. It illustrates that well-designed and consistently applied performance management can indeed drive tangible, positive improvements.
So while Perry and Babitsky highlighted the limits of just changing ownership structure without fixing incentives, Poister, Pasha, and Edwards suggest focused management practices. Clear goals, planning, consistent measurement can yield real results. It seems the how of management is crucial.
Exactly. Which brings us nicely to looking at specific, practical methodologies for doing this effectively.
Okay, so if performance management can work, as we've now seen evidence for, how do organizations actually do it effectively? What are the specific methodologies? Our next source, John Maleyeff's Improving Service Delivery in Government with Lean Six Sigma, offers a really disciplined, project-based approach.
Yeah.
What exactly is Lean Six Sigma? Sounds kind of intense.
It is pretty rigorous, yeah. Lean Six Sigma, or LSS, is a powerful methodology that combines two distinct but very complementary management approaches, Lean and Six Sigma.
Okay, break those down. What's Lean?
Lean thinking fundamentally focuses on identifying and maximizing value from the customer's perspective. It involves meticulously mapping out every step in a process, the value stream, and then relentlessly removing all non-value-added activities, which it can waste.
Getting rid of stuff that doesn't help the customer.
Exactly. The goal is seamless flow, creating pull based on customer demand, and continuously striving for perfection. Its tools often involve detailed process mapping, root cause analysis, and these rapid improvement events called Kaizen events for quick wins.
Okay, and Six Sigma.
Six Sigma aims to improve customer service by minimizing process variation and drastically reducing errors or defects to near perfection levels, like 3.4 defects per million opportunities. That's the target.
Wow, precise.
Very. It uses a highly structured, data-driven 5-step approach called DMAI. Define, measure, analyze, improve, and control. Six Sigma traditionally employs more statistical methods for rigorous data analysis, optimization, and ensuring process control.
So combined.
Combined, LSS emphasizes a holistic focus, customer satisfaction, continuous improvement culture, deep root cause analysis, and really comprehensive employee involvement and training.
Sounds very useful, especially for manufacturing where it started. But Maleyeff notes applying it in government requires adaptation. What are the unique challenges in the public sector? Why is it harder there?
Oh, there are several significant challenges, some common to any service organization, but often amplified in government.
Right.
Inconsistent leadership motivation. Sustaining commitment long-term can be tough with political cycles, changing administrations. A new leader might just scrap the old initiatives.
Right. Undermines the effort.
Totally. Then there are union rules and regulations and job security concerns. These can be huge hurdles for process changes. Employees, often protected by strong agreements, might fear efficiency means job losses, naturally creating resistance.
You need buy-in.
Crucial. And often you have prevalence of undocumented processes. Many government processes just aren't clearly written down or standardized. Different departments might do the same thing differently. Hard to improve what you don't fully understand.
Yeah, that makes sense.
And beyond those, government has unique things. Public skepticism, legislative controls dictating how things are done, competing special interests, the election cycle, all hindering sustained long-term efforts.
So with all those barriers, how can a government entity make LSS succeed and, importantly, sustain it over time? What are the critical success factors Maleyeff points to?
He identifies several key factors, and they often require real cultural and structural commitment.
Okay.
Constancy of purpose, a consistent underlying methodology, continuously reinforced, not a flavor of the month thing.
Needs to stick.
Yeah. Long-term leadership. Key leaders need to stay in place for lengthy periods for consistent vision and resources. High turnover kills these initiatives.
Makes sense.
Guaranteed job security. This one's huge. Employees must be explicitly guaranteed they won't lose jobs due to efficiency projects. Builds trust, removes fear.
That seems absolutely vital.
It is. Also, long-term vision. Measuring success in years, not weeks or months. Patience is key. And finally, culture change. Actively removing barriers, challenging assumptions, modifying the culture to embrace continuous improvement, data, process thinking over blame.
Those sound like major undertakings. Requires real will.
Oh.
But are there examples of government organizations actually doing this successfully, showing it's achievable?
Definitely. Maleyeff provides several compelling examples showing LSS's impact.
Oh, good. Like what?
The Department of Defense, DoD. They implemented a big continuous process improvement LSS initiative. The Army's broadening adoption. Air Force has islands of excellence in maintenance. Navy's even further along in commands like SPAWAR and Navicia. Streamlining logistics, admin, maintenance.
Massive scale.
Yeah. Then Washington State Department of Social and Health Services achieved a remarkable $23 benefit for every dollar invested in their LSS training program. Clear ROI.
Wow.
The National Nuclear Security Administration, NNSA, aggressively using LSS to cut delays in procurement, finance, security clearances, typical bottlenecks, often developing standardized procedures.
Okay. More local examples?
Yep. Fort Wayne, Indiana. Pothole repair, great example. Using basic tools, they cut average repair time from about 4 days to at most 3 hours. Same number of employees. Huge win for citizens.
Fantastic.
Washington State Department of Licensing. Cut customer wait times by 50% or more in many offices. Big boost to customer and employee satisfaction.
Well, that's tangible.
And Oregon's Lane County Vehicle Maintenance started after a fatal accident. Their LSS project focused on safety, creating standard pre-trip inspection procedures for heavy equipment. Shows it's not just about efficiency, but safety too.
These are really impressive results across such different areas. So that DMAIC process, define, measure, analyze, improve, control, how does that structure actually help achieve these kinds of improvements? Walk us through it.
Okay, the DMAIC structure is critical. It ensures that disciplined, data-driven approach, tackling many issues of the performance paradox head-on, like lack of process understanding or focusing on symptoms.
The first step, define.
Right. Paramount. Clearly articulate project goals, benefits, and crucially, the voice of the customer. What do they actually need or value? Create an elevator speech so everyone's on the same page about the problem, why it matters, what success looks like. For potholes, faster, durable fixes.
Okay, and then measure.
Here you map the current process comprehensively. Visual tools like process maps. Collect relevant data cycle times, error rates, wait times. Understand how it currently flows, where it gets stuck. Critically shifts focus from blaming people to understanding the process. Measure actual time from pothole report to fix.
Got it. Analyze.
Now, with maps and data, systematically identify waste, non-value-added activities. Maleyeff lists 7 types. Delay, review, mistake, duplication, movement, processing inefficiency, resource inefficiency. Then use tools like the 5 whys, keep asking why, to drill down to the root causes, not just symptoms. Why does it take 4 days? Waiting for equipment, paperwork.
Makes sense. Find the real bottleneck, then improve.
Yep. Generate and rate creative ideas aimed specifically at eliminating that waste or adding value. Key caution. Avoid automating waste. Don't just digitize a broken process. Redesign paperwork for better info flow, streamline handoffs, new scheduling. Fort Wayne likely optimized crew routing, materials.
And finally, control.
Often overlooked, but critical for sustaining gains. Develop robust plans to maintain improvements, track ongoing performance, prevent old problems returning. Document revised procedures, checklists like Lane County's inspections, ongoing training, follow-up meetings, make the new process stick and evolve.
It sounds like a really robust framework for consistent long-term improvement. It directly addresses many paradox issues by focusing on root causes and sustained change, not just superficial metrics. Now let's explore a very specific application, tying funding directly to outcomes through performance contracting. All right, let's shift gears a bit to another approach, one that really links funding directly to results, performance contracting. Our source, Performance Contracting for Substance Abuse Treatment by Commons, McGuire, and Riordan, dives into Maine's experience with this. What exactly is performance contracting, and why did Maine adopt this specific kind of high-stakes approach for substance abuse services?
Yeah, performance contracting is, in essence, a pretty strategic, often bold shift in how government funds services. It means moving beyond just paying for delivering a set number of services like therapy sessions.
Downing widgets.
Exactly. To tying government funding directly to specific treatment processes and, crucially, to measurable client outcomes, actual results.
Okay, why did Maine do it?
Well, Maine's Office of Substance Abuse, OSA, instituted this back in 1992 because, as Smith and Lusky pointed out, it's actually very difficult for a government agency, the funder, to know if a clinician's judgment in selecting and treating people was sound or if the services were genuinely effective.
Hard to look over their shoulder.
Right. Makes it hard to ensure good outcomes from traditional contracts that just count services. Maine, facing a growing substance abuse crisis, wanted to ensure the services they funded actually worked to help people recover, not just that services were delivered.
So moving beyond counting services to measuring actual results, tangible changes in people's lives, much more ambitious. How did Maine's system work? What specific outcomes were they looking for to define success? Sounds complex.
It was indeed quite comprehensive, designed to capture multiple dimensions of success. Their performance-based contracting, PBC system, grouped program performance into 3 distinct categories. Programs had to meet minimum levels on a specified number of indicators within each category.
Okay, what were the categories?
First, efficiency standards. These mainly measured service utilization, requiring programs to deliver a specific percentage of their contracted service units. For outpatient, it even specified a minimum percentage had to go to primary clients, preventing providers from just focusing on easier cases, making sure resources were used as intended.
Got it. Second.
Effectiveness standards. This was the crucial outcome-focused category, looking at genuine treatment outcomes at discharge. It included critical measures like client abstinence from substance use or significant reduction in use.
Real results.
Exactly. Also, improvements in employment status, reduction in arrests, positive changes in social functioning, relationships, direct measures of client improvement and recovery.
And the third category.
Special population standards. These were strategically designed to ensure services reached target groups considered harder to treat or historically undertreated women, adolescents, the elderly, polydrug users, IV drug users. This category also deliberately helped deter that cream skimming or cherry picking we talked about.
Right, preventing them from avoiding tougher clients just to boost other metrics.
Precisely. It was a well-thought-out structure.
Seems like a very comprehensive set of measures, covering quality, access, impact, addressing paradox issues. What did OSA actually do with this data? Did they just immediately cut funding for low performers? Or was it more nuanced?
Their approach, especially initially, was quite nuanced. Focus on improvement, not immediate punishment, which is a critical lesson, I think. OSA staff monitored performance quarterly. If programs failed to meet standards, they weren't immediately defunded.
Okay, what then?
Instead, they were asked to submit corrective action plans, identifying causes, outlining steps for improvement. While the 94 contracts were the first officially subject to review based on performance, few funding cuts happened at first. The initial focus was more on technical assistance, encouragement.
Like what?
Well, they might impose special conditions, like requiring specific outreach for programs underperforming on, say, the AIDS 019 indicator. Or, in more serious cases, maybe give only 6-month contracts to low performers to create urgent incentive for improvement rather than just terminating them. It was phased, supportive, aimed at building capacity.
Okay, so after some time with this structure in place, what did the rigorous data analysis show? Did performance contracting actually lead to better performance? Or did it just show numbers changing without real improvement?
The regression analysis, carefully designed to isolate the PBC effect from general time trends, yielded some significant and very nuanced findings, key to understanding the real impact.
Okay, what did they find for efficiency?
Efficiency. They saw a positive time trend efficiency was generally improving anyway. However, the direct PBC effect itself was actually negative for an average program.
Oh, interesting.
But here's the crucial part, the aha moment. A positive and significant interaction between PBC and how much an agency relied on OSA for funding. Meaning, for programs heavily dependent on OSA's money, PBC did lead to increased efficiency. Like, a program completely dependent on OSA saw a substantial 40% increase in efficiency. Shows the power of financial leverage when incentives align.
Wow. Okay, what about effectiveness?
The outcomes.
Effectiveness. Here, results were more uniformly positive. Both the time trend and the direct PBC effect and the interaction term were positive and significant.
So it worked better for outcomes.
Yes. Overall effectiveness, as defined by the state's outcome measures, improved significantly since the new system. The average program improved effectiveness by 5.7%. Those more reliant on OSA saw even greater improvement, maybe a 13% improvement if they had 20% above average reliance. Truly meaningful impact on client lives.
That's great news. And the special populations.
Special populations. Interestingly, no significant effect of PBC here, only a small positive time trend. Suggests that while the general system improved, the targeted incentives for special populations weren't as effective in driving distinct improvements there. That's a really nuanced picture. Not simple. But the most convincing part, you said, was that interaction effects, stronger impact for programs more reliant on OSA. Why is that interaction so important?
It's critical because it suggests PBC wasn't a magic bullet, but its impact was strongest exactly where theory says it should be strongest, where OSA's financial leverage and sanctions were most powerful. It makes the case for a causal link much more compelling than if the effect was uniform. It indicates clear incentives and accountability tied to funding can drive specific changes, especially when the principal, OSA, has real influence over the agent, the provider, highlights the importance of aligned incentives and power dynamics.
That's a powerful lesson. But the study also notes limitations.
Right.
Especially about the data itself. Common challenge.
Yes, a major limitation common across the public sector is that the research relies on performance data reported by the agencies themselves.
Oh. Self-reported data.
Exactly, which naturally raises the possibility that some observed improvements could be due to changes in reporting practices, agencies just getting better at documenting, or maybe even, fudging the numbers rather than genuine shifts in actual performance.
Right.
The authors acknowledge this explicitly. Future research would need to try to separate the real from the reported impact, maybe look at client-level factors, highlights that ongoing challenge, ensuring data integrity when stakes are high.
Okay, so we've covered quite a journey. The initial audit explosion, the persistent performance paradox with all its pitfalls, sophisticated tools like Lean Six Sigma, and targeted approaches like performance contracting. It seems really clear the path from good intentions to actual improved outcomes in the public sector is, well, paved with both big challenges and, when done thoughtfully, real opportunities.
Absolutely. And if we try to connect all these threads, synthesize the learnings, what stands out is that performance measurement in the public sector is never just a simple, neutral, technical thing.
Right. It's political, it's behavioral.
Exactly. It's deeply shaped by organizational characteristics, political dynamics, human behavior, which means it can sometimes lead to those unforeseen consequences, or even deliberate gaming, as Van Thiel and Leeuw showed so vividly. Ignoring that social and political reality is where many efforts stumble.
Which brings us to the crux of it all. After exploring all this, when does performance management actually fail, and when does it truly succeed? What are the conditions that lead one way or the other?
It often fails, I think, when that initial belief in measurability is too simplistic, leading to over-reliance on metrics without deep understanding of their limits or context.
Right. Resulting in
measure fixation, the number becomes the goal, tunnel vision only counting the easy stuff, or ossification organizations getting rigid, afraid to innovate, like Van Thiel and Leeuw highlighted. It fails when measures aren't suited to the complexity or ambiguity of public programs, or when the data lacks validity, as Poister, Pasha, Edwards, and the main study limitations pointed out.
And definitely fails if it creates mistrust.
Absolutely. If it breeds distrust, prompting organizations to game the system through cream skimming or sabotaging audits, it's doomed. A system built on mistrust will inevitably be undermined.
But on the flip side, the transit studies, the Lean Six Sigma examples, they offer a compelling case for success. Improvement is possible. What are the common threads, the key ingredients we can pull from those successful implementations? What's the roadmap forward?
Several key themes consistently emerge, I think, offering a clearer path.
Okay, first.
Clear, outcome-oriented goals. Poister, Pasha, and Edwards showed strategic planning, especially blended with adaptive approaches, clarifies priorities, and drives performance in transit. Commons, McGuire, and Riordan showed tying funding directly to desired outcomes like abstinence and employment in Maine can be highly effective. Incentives aligned with ultimate policy goals. The clearer the why, the better the how.
Makes sense.
What else? Disciplined methodology. Maleyeff's Lean Six Sigma demonstrates the power of a structured approach like DMAS, systematically identifying root causes, eliminating waste, driving continuous improvement repeatably, forces deep understanding before acting, moves beyond ad hoc fixes.
Right. Structure helps. Third.
Leadership commitment and trust. Maleyeff's emphasis here is crucial. Sustained LSS needs long-term leadership, active removal of barriers, and that vital guarantee employees won't lose jobs due to efficiency gains. Builds essential trust, encourages genuine participation, candid problem identification, not fear-driven gaming. Trust is foundational.
Absolutely key. Next.
Data-driven but context-aware. While Perry and Babitsky showed simply privatizing isn't a magic bullet, Poister et al., and Commons et al. Show carefully designed and applied measurement can work, especially when incentives align. It's not just collecting data, but how it's used, interpreted, integrated into decisions within its specific context, acknowledging limitations like self-reported data.
Use data smartly, not blindly.
Exactly. And finally, focus on process, not just numbers. Maleyeff's distinction between waste and value, using tools like 5 whys for root causes, critical, helps organizations get deeper than surface metrics, preventing measure fixation and tunnel vision. Understanding why performance is what it is, scrutinizing the actual steps, allows for more fundamental, lasting improvements, addressing systemic issues, not just symptoms.
So what does this all mean for you listening today? Whether you're a student PP 5340, a practitioner, just a curious citizen navigating this world of public policy and management, what's the actionable takeaway? Hashtag outro.
Well, it raises, I think, a really important question, rather than asking if performance measurement works, because clearly it can, under the right conditions. Perhaps the more critical question for public sector leaders, managers, and for you as a future leader is how? How can we design and implement performance management systems that actively mitigate the paradoxes and unintended consequences we've discussed, and instead genuinely foster improvement and accountability?
Yeah, it's a shift in the question.
It is. From should we measure to how do we measure smartly, ethically, effectively, ensuring we don't inadvertently create the very problems we're trying to solve.
That's a really powerful thought to leave with you. It's not about abandoning measurement, which has clear benefits when done right, can drive progress. Instead, it's about approaching it with a much deeper understanding of human behavior, organizational dynamics, the unique political and operational challenges of the public sector. The ultimate goal isn't just to count things, but to count what truly matters, and then use that information wisely, transparently, ethically, to create better, more responsive, more effective public services for everyone.
Indeed. And that requires critical thinking, a willingness to constantly question assumptions about how data reflects reality, and a real commitment to continuous learning, not just for the organizations implementing these systems, but for you, the learner, as you engage with and maybe someday shapes public policy. It's an ongoing journey.
Absolutely. And that's our deep dive for today. We hope you've gained some valuable insights into this complex yet absolutely crucial world of performance measurement and management in the public sector. Until next time, keep asking those big questions and keep exploring.